Okay, so the topic of the lecture is cancer epidemiology and prevention. These are the learning objectives, uh, which are the definition of cancer and its epidemiology, classification of cancer, discussion of different carcinogens, and the levels of prevention of cancer. So what basically is cancer? Cancer is a group of diseases characterized by abnormal growth of cells and ability to invade adjacent tissues and even distant organs of the body. So there are definitions in cancer. The first of which is neoplasia. Neoplasia means new tissue growth that is unregulated and irreversible. So cancer is an uncontrolled proliferation of cells that express varying degree of fidelity to their precursors. And the cancer is of two types, benign and malignant. Benign is when cells grow as compact mass and remain at their site of origin and do not metastasize. They are usually well differentiated and well demarcated. So what is well differentiated, we'll study in the next slide. And then malignant cancer. Malignant cancer in which growth of cells is uncontrolled. Cells can spread into surrounding tissue. They can spread at the two distant sites and have the potential to metastasize and invasion. Carcinoma implies epithelial origin. So when the carcinoma is, word carcinoma is used in malignancy, it means that the cancer is of epithelial origin. And when sarcoma is used, it means it is of mesenchymal origin. Okay, so this is the leading cause of death worldwide. The most common cancers by incidence in adults are breast in females, prostate in men. Second is lung cancer and third is colorectal cancer. The most common causes of cancer mortality are the first is lung cancer, second is breast in females and prostate cancer in males, and third is colorectal cancer. Okay, so these are different terminologies that are used for primary side. When the cancer is supported in the cancer is reported in the cells of origin, it is called as primary side. The secondary side is that site in which cancer spreads through distant organs through metastasis. Benign and malignant we have already discussed. Carcinomas and sarcomas. Carcinoma, as I told you, implies that malignant tumor is arising from epithelial tissue. Sarcomas means malignant tumors arising from mesenchymal tissue, and lymphomas and leukemias are tumors arising from hematopoietic tissues. Then grading is important in cancer. Grading is degree of cellular differentiation on histology. So what is differentiation? Differentiation is degree to which tumor resembles its tissue of origin. Well differentiated tumor means that the cancer is of low grade and it resembles the tissue of origin, whereas poorly differentiated means the cancer is high grade and it do not resemble the tissue of origin. So poorly differentiated is it has bad prognosis compared with well differentiated. Then we have a staging system, international staging system, which is used for solid tumors for staging cancers. It is based on tumor node and metastasis. So the degree of spread is based on site and size of primary lesion. It has more prognostic value than grading. So the T stands for tumor, the size of primary tumor. Node means the local and regional node involvement. For example, the axillary lymph nodes are involved in breast cancer. And then the metastasis. Metastasis means the spread of cancer from one side to non-adjacent sites. For example, breast cancer spreads to lung, so that is called as metastasis. The lung cancer spreads to brain. The primary site is lung and the secondary site is brain. So the cancer metastasizes through the blood or the lymph. The cancer cells travel through the blood or lymph to other vessels, and when they escape the blood vessels, they cause malignancy at the secondary sites. So we have the staging system T, N, and M. So the TX means that the primary tumor cannot be assessed. T naught means that there is no evidence of tumor. TIS means that there's carcinoma in situ. That means the cancer has not invaded the basement membrane. Then the numbering includes T1 to T4, which includes the tumor size and involvement. Then N means presence or absence of lymph node involvement. NX means regional lymph node involvement cannot be assessed. And not means there is no lymph node involvement, and 1, 2, and 4 is increasing degrees of regional lymph nodes involvement. Then there is distant metastasis. MX means that the distant metastasis cannot be assessed. M naught means that there is no evidence of metastasis, and M1 means there is evidence of distant metastasis. Then there are certain hallmarks of cancer. So how does cancer occur? Cancer is caused by DNA mutation that affect fundamental cellular process. There are mutation in oncogenes, which convert into proto-oncogenes responsible for cancer development. Then mutation in tumor suppressor genes. So what happens is there is DNA mutation that results in abnormal cell replication. And normally we have normally enzymes that and genes that produce enzymes that limit the ability of cell to divide, but those are also get mutated in cancer. Then evasion of apoptosis. The normal programmed cell death is evaded by cancer cell because there is mutation in genes regulating apoptosis, which results in limitless replicative potential. Then, of course, the new tumor development requires nutrients and oxygen for its sustenance in body. So there is the tumor releases vascular endothelial growth factors, resulting in increased angiogenesis. And then there is tissue invasion, resulting in invasion of basement membrane. Then there is cachexia, which is weight loss, muscle atrophy, and fatigue that occurs in chronic diseases like cancer. So what are the risk factors? Tobacco use is the single most important risk factor. And then there are certain infections such as hepatitis B, hepatitis C, and human papillomavirus. Leading behavioral and dietary risk factors such as high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. So the risk factors include, as I told you, tobacco, physical inactivity, alcohol use, hepatitis B virus, chronic human papillomavirus, which is sexually transmitted by viral infection of reproductive tract, environmental pollution of air, water, and soil with carcinogenic chemicals, radiations. Radiations cause skin cancers as well as thyroid cancers and reproductive factors. So the carcinogens can be divided into physical, chemical, and biological. The physical carcinogens such as ultraviolet and ionizing radiations damage the skin, resulting in skin cancer. Then we have chemical carcinogens such as asbestos, which causes lung cancer, mesothelioma, aflatoxin, which is a food contaminant, arsenic, drinking water contaminant, biologic carcinogens such as viruses, bacteria. So this is a comprehensive list which shows different carcinogens. For example, aflatoxin causes hepatocellular carcinoma, alcohol causes oropharyngeal cancers, cigarette smoke causes lung cancers, and then we have viruses like EBV virus, Epstein-Barr virus, which cause nasopharyngeal cancer. Hepatitis B and hepatitis C causes hepatocellular cancers. Then we have human papilloma virus, which causes squamous cell carcinoma of reproductive tract. Then radiation causes cancers of thyroid and skin. The list continues. So what are the levels of preventive strategies? There are three: primary prevention, secondary prevention, and tertiary prevention. Primary prevention includes in which we avoid the development of disease by removing risk factors. The secondary prevention includes early detection through screening and the treatment of disease to prevent progression. And tertiary includes reduction in complications of established disease. So how can we reduce through primary prevention, control of tobacco and alcohol, personal hygiene, limiting radiation exposure, the occupational exposure to certain environmental factors, immunization, food, drugs, and cosmetics, air pollution, legislation. Secondary prevention includes cancer registration by hospital-based registries and population-based registries, early diagnosis, cancer screening, treatment. Treatment includes surgery, chemotherapy, radiotherapy. So what is the purpose of cancer registry in secondary prevention? To collect data about cancer systematically, summary of patient history, diagnosis, treatment, and the status of every patient. It is the population-based cancer registry contain record for people diagnosed with a specific type of cancer who reside within a defined geographical region. Hospital-based cancer registry in Pakistan, in which hospitals maintain their own record of the cancers, and these are set up in our local hospitals. Okay, so there are certain tumor markers for screening which include alkaline phosphatase, alpha fetoprotein, which is used for hepatocellular carcinoma, CEA, which is used for colorectal and pancreatic cancer. So why is cancer screening important? It is important because in many instances, malignant disease is preceded for months by pre-malignant lesion, removal of which prevents subsequent development of cancer. The methods include mass screening and selective screening. The mass screening is for diseases in which the overall population is increased. or is at increased risk for development of diseases like prostatic cancer, like cervical cancer. And selective screening is for people who are at increased risk for development of cancers which runs in families, like colorectal cancer. So the cancer screening tests normally done include breast cancer screening tests, which are recommended for women aged over 40 years. It is operated with mammogram procedures and clinical examination, self-examination. Then there is lung cancer screening test, which is recommended for people over 55 years old who smoke around a pack of cigarettes a day for over 30 years. It is operated with low-dose computerized tomography. So the breast cancer screening option includes self-exam, clinical exam, mammogram, which is our customized X-ray, ultrasound, MRI imaging. The lung cancer screening includes low-dose CT scan, which can detect lung cancer early on. Recommended for adults aged 55 and above, heavy smoking history, who have smoked for a long period of time and then eventually quit. Then colorectal screening test. It is recommended for people aged between 45 to 50 years, operated with colonoscopy and blood test. Colonoscopy is basically a camera is inserted through rectum to visualize the colon, and any abnormality in mucosa is biopsy to send for histopathological test. Then for prostate screening test, digital rectal examination and prostate-specific antigen tests are recommended. In digital rectal examination, in which prostate is felt by the clinician, and if the normally the prostate is soft, if the prostate is hard and indurated, then there is malignancy of prostate, and we can clinically correlate it with prostate-specific antigen. Then liver cancer screening test is recommended for women aged over 50-year-olds and people who have hepatitis B virus or C virus, or people with a history of alcohol drinking. It can be operated with upper abdominal ultrasound scanning procedure and alpha fetoprotein test. So this is the picture of colonoscopy in which a camera is being inserted through the rectum. This is the digital rectal examination in which the prostate is felt, and it is important to get screened for these diseases. Then tertiary prevention. Tertiary prevention is offered in form of palliative care uh, in which treatment is offered to reduce the intensity of pain and to ease the suffering. And it is offered for terminally ill patient in which there is no conventional treatment available. Includes medical, psychological, social, and vocational rehabilitation. Then we'll study epidemiology of selected cancer, oral cancer. Oral cancer is one of the 10 most common cancers. High frequency in Central and Southeast Asian countries. In 2012, almost 2 lakh new cases happened in countries and 98,000 deaths were reported. Malignant neoplasm of squamous cells lining the oral mucosa. The risk factors include tobacco, alcohol, and it is initially it results in precancerous stage and high risk groups and cultural patterns. For example, in Pakistan, India subcontinent, there is culture of using pan, gutka, and other betel nuts, which result in increased incidence of cancer in these groups. How can this be prevented? The primary prevention include if the tobacco habits are eliminated from a community, requires intensive public education and changing lifestyle. The secondary prevention, oral cancers are easily accessible for inspection, allowing early detection. The main treatment, these are biopsy to rule out carcinoma, can be cured by cessation of tobacco use. So there are two types of cancer, precancerous stages. One is erythroplakia, second is leukoplakia. Leukoplegia is like white covering of the tongue which cannot be scraped off, unlike Candida thrush. And when the leukoplegia gets vascularized, it results in reddish lesion, which is called as leukoplakia. So these are precancerous stages. Then cervical cancer. This is the second most common cancer among women after breast cancer worldwide within 2012. 5,27,000 cases, new cases were reported with more than 26,000 deaths. It is caused by human papilloma virus. The natural progression of disease includes first there is normal epithelium, and then after the pathogen has entered, it results in dysplasia. Then there is cancer in situ, and then there is invasive cancer. The risk factors include age, increasing age, from 25 to 45 results in increasing incidence. Oral contraceptive pills results in hormonal disbalance, which increases the chances of cervical cancer, and then there's this family history. So the primary prevention for cervical cancer can be improved personal hygiene and birth control. The secondary prevention rests on early detection cases through screening and treatment by radical surgery and radiotherapy. Goal of screening is to catch dysplasia before it progresses into cancer. So the pap smear is the most common employed procedure. It is the gold standard procedure. It is responsible for significant reduction in mortality and morbidity. So in which a specimen is taken from a brush from the kit, and it is then stored in a specimen and then visualized and sliced under a microscope. So this is the kit that is used for pap smear. Then breast cancer. This is the most frequent cancer among women with an estimated 1.67 million new cases diagnosed in 2012. The risk factors include age, usually postmenopausal, and family history. The BRCA1 and BRCA2 genes are responsible in family history, and age, hormonal factors, and oral contraceptive. So these are the early signs of breast cancer: a new lump, nipple change, skin change, shape change, and nipple discharge. Okay, so how can we prevent breast cancer? Elimination of risk factors and promotion of cancer education. And secondary prevention include screening, which leads to early diagnosis of breast cancer, which in turn influences treatment and mortality. Another important component is follow-up to detect recurrence as early as possible. Then lung cancer. Lung cancer has been the most common cancer in the world for many decades. Most common cause of death in developing countries. Epidemiological features, obviously, because more males smoke than females, so it tends to affect more males than females, and age. After chronic exposure to smoking, there is certain time period for development of lung cancer. The risk factors include smoking, obviously, which contains components like tar, carbon monoxide, and nicotine, and their carcinogenic role is well established. These also contribute to cardiovascular disease. Then asbestos. Asbestos is a component of construction industry and mining. The people employed in construction industry develop these diseases, and it results in lung cancer known as mesothelioma. Then radon. Radon is also an important cause of lung cancer in those people who are non-smokers. So how can we prevent lung cancer? The greatest importance include controlled smoking epidemic, which includes public information and education, legislative and restrictive measures, which means to do certain legislation which restricts the access of cigarette smoke packs to certain age groups only, and then smoking cessation activities, national and international coordination. Advertisements should be run on TV to counsel the population regarding the harmful effects of smoking. Then secondary prevention, early detection of cases and treatment. Procedures capable of detecting early stage include chest X-ray, low-dose CT, CT, computer tomography, and sputum cytology. And then we lastly have stomach cancer. About 1 million new cases of stomach cancer were reported in 2012. It is the third leading cause of death in both sexes worldwide. So H. pylori is the causative pathogenic bacterial organism which is responsible for acute and gastritis. So gastritis needs to be treated clinically, and is treated by triple treatment, which includes amoxicillin, clarithromycin, and proton pump inhibitor omeprazole. And if the gastritis is left untreated, and it results in chronic gastritis and chronic irritation and inflammation of gastric mucosa, it results in stomach cancer, and it tends to spread to duodenum and liver. And by the time it is diagnosed, the cancer has already metastasized to a number of organisms, and the conventional treatment and becomes useless for it. So the patient is offered curative care. So the symptoms are non-specific, include weight loss, gastric discomfort, and fatigue. Diagnosed by barium X-ray, esophageal gastric duodenoscopy, and bioscopy. And there is poor survival prognosis. The survival rate, the 5-year survival rate of patients with stomach cancer is less than 20%. Thank you. That's all.